Hi, I'm Dani Gasparini, and welcome to this segment of Penn Voice. I am joined by Dr. Bonnie Jew, who is the CEO of Sonrisas Dental. Bonnie, thanks for joining us.
Thank you so much, Dani.
So you are recently the new CEO for Sonrisas Dental, and before we kind of get into the dental practice and what makes Sonrisas so special, tell us a little bit about how you found yourself to be not only a dentist, but to get involved with a nonprofit dental practice, which is so unique.
Okay, well, thanks. Well, I'm been a general dentist for over 25 years now, and I actually was working in my family's private dental practice in San Francisco for a majority of that. But for my entire career, I've been teaching part-time at the University of Pacific Arthur A. Dugoni School of Dentistry. That's a mouthful.
It is.
UOP Dental School in San Francisco, and I do research at UCSF there. So this is actually at Sonrisas Dental Health. It's been the first position in which I've been able to actually merge all of my different worlds of dentistry into one position. So I've been really grateful for that. In 2015, when Sonrisas Dental opened, I was employed as an associate dentist there. And more recently, when our former dental director retired, they asked me to be the dental director and now CEO.
Well, this is a perfect segue then into telling us a little bit about Sonrisas as a dental practice and the unique part about being a nonprofit dental practice.
Right, there are not too many of us around here or anywhere in California,
right.
Actually. Yeah, you know, we're an independent nonprofit dental center. And we have two locations, one in San Mateo and one in Half Moon Bay, which actually opened up in 2001. And we serve patients of all ages, children, elderly patients, and people with special needs. Okay. In fact, I have a lot of patients who actually are in wheelchairs and really appreciate that we have special equipment that can gently transfer them from their wheelchair to the dental chair in a comfortable manner. And that is something that you know, I might not have been able to provide in my private dental office.
Right.
Whereas with this nonprofit dental center, we actually are supported by local community agencies, the Peninsula Healthcare District,
right.
to be able to provide these services for their community members.
Which I want to ensure that everyone understands that it's really, quite frankly, a regular dental practice by if I walked in the doors and what I would expect if I went to my, as you were in private practice with your family, what I might experience with my private dental. It just allows you to do more in your community and get exposed to more abilities to serve in your community. So let's jump right into that. What are some of those special things that as a nonprofit dental practice you are able to provide and to do as far as outreach?
Oh, wonderful. So we're actually a bit of a hybrid. I say that and people think we're a Prius, but if that helps you remember us, then that's great.
Right.
Well, so we're, you know, we're not a federally funded clinic, but we also are not a traditional private dental practice.
Right.
We're a little bit of both. And we can see patients who have private insurance, who have no insurance, and who have Denti-Cal.
Right.
Now, Denti-Cal is part of Medi-Cal, which is California's version of Medicaid. And it's terrific that we have that here, but unfortunately, Denti-Cal can provide only a fraction of the funding for how much it costs for regular dental services. So there tends to be a huge gap in that funding.
Right.
As a nonprofit dental center, we rely on donations from philanthropic organizations or individuals so that we can continue to provide care for those who are lower income. There are about 120,000 residents of San Mateo County who have Medi-Cal, but there are, I believe, fewer than 15 dental providers
right.
that can actually see patients who have Denti-Cal.
And I think one of the things that viewers may not know is there are so many health implications that actually start in our mouth. And it's not just about either straightening teeth or having a cavity filled, but it's actually about preventative care and cleanings because again, that is one of the greatest sources for other health implications that happen in someone. So this this early and preventative care that you also provide, as well as the dentistry if they need something further, is so important for families to understand that they have access to and have the ability to come see you and figure out how that payment is going to happen, because you have such flexible abilities to receive payment in that regard.
Exactly. I'm so glad you bring up the fact that oral health actually affects our overall health.
Right.
Because for such a long time, and still now, a lot of people don't realize the mouth is part of the body. And so if there's bacteria and germs in the mouth, it can affect other areas and other medical conditions.
Right.
Yeah, so I feel that, and my whole career has been based on that, on this, is that preventing dental disease is as important as treating it.
Right.
Yeah.
The health implications are huge. And you also do something that's such a great program, and it's called Get a Smile, Give a Smile. And that's kind of that philanthropy side to what your practice does, and gives the ability for the community to get involved in ensuring that all people have access to your dentistry.
Right, right. I have the flyer right here. With the, because we're not funded by any one source, we rely on a variety of resources to be sustainable. And through the Get a Smile, Give a Smile program, patients who have private dental insurance can come see us and get the same quality dental care that they will anywhere else. And in doing so, they are actually helping to cover some of the costs of dental care for a patient in need, somebody who maybe has Denti-Cal or no insurance.
Right.
Yeah, and a lot of my patients actually really appreciate being part of this program, because they know that by doing something they normally would anyway, which is seeing the dentist, they are actually helping somebody else that might otherwise not be able to seek dental care elsewhere, such as a child or a veteran.
Right. And again, when you think about just that basic part of a smile and receiving a smile and seeing a child with a smile on their face, but perhaps a child might not feel confident enough to do that because they are missing teeth or they haven't had great oral care. Just the ability to help children receive that confidence back and changing their lives by their smile and their ability to show their teeth is just such a wonderful thing for people to be able to be a part of. So I thank you for connecting the community to do that as well. Bonnie, you mentioned previously that you accept different insurance from different patients of different insurance providers, but also too you have kind of a sliding scale for payment when your patients see you. Tell us a little bit about that.
Okay. Well, in addition to being able to see most private dental insurance plans, including PPOs or preferred provider plans, we offer a sliding fee scale for families and patients depending on their income level. And they could qualify possibly for a 10, 20, or 30% discount based on their income level.
And you mentioned the accessibility. So how can people find out about your services and getting involved? Because you said Half Moon Bay and San Mateo.
Right, right. So, well, the best way to find out is to call our office.
Okay.
We have our main center in San Mateo, but we also have the clinic in Half Moon Bay. We actually also have a mobile dental program in which we are able to bring full-size dental equipment. We roll it onto our Big Mac truck. We don't do the dentistry in the truck, though.
Right.
It's just used to transport it to a facility.
That's amazing.
And we roll it off the truck, set it up in a room, in a place perhaps where the residents there can't have difficulty going into a dental office, such as a nursing home or schools. And we can do the dentistry right there. We set up for the whole day, and I have a staff that provides dental care there. So that's been wonderful to be able to do that. And that's something I wasn't able to do in a small office.
In addition to your mobile care program, you also have a farm worker program, and we just have about a minute left, but tell us about your farm worker program.
Okay, so through this wonderful program, we get some funding through the county to bring our mobile equipment down to Pescadero, which is along the coast side.
Right.
Beautiful area, but difficult to find a lot of healthcare providers there.
True.
So we partner with the Puente Community Center there, and we are able to provide dental care for farm workers and their families who live and work in the area. And we've had families tell us or patients tell us that without this program, they wouldn't know when they would be able to see a dentist.
Right. I mean, imagine working the hours that our community is working these days, and almost 24/7, the ability to have an accessible dental unit in your community or in your place of work has just got to be amazingly beneficial to all of our groups of individuals in San Mateo County. So thank you for that. Sure. Well, we now are out of time, so I want to thank you so much for bringing all of us. Congratulations on being CEO of Sonrisas, and thank you so much for bringing the programs and continuing the programs in San Mateo County and in Half Moon Bay.
Well, thank you so much, Dani.
And we'll see all of you next time on Penn Voice.